Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome Dr. Todd Tams. Dr. Tams is a diplomate of the American College of Veterinary Internal Medicine. For many years was the Chief Medical Officer for VCA Animal Hospitals, and most recently worked with Mars Veterinary Health as a Vice President for External Affairs. Welcome, Todd. It's great to have you here.
Hey, Marie, thank you very much for having me. It's my pleasure. I'm very excited to be with you today.
I am honored to have you. So we're going to jump right into some questions. And we talk to a lot of people in veterinary medicine on this podcast. So I'm going to start with the same question with you to tell me a little bit about your journey in veterinary medicine and where West Los Angeles Animal Hospital came into that picture.
Well, I've had an amazing journey in veterinary medicine. I've been very fortunate. I've had a lot of people along the way, along my career path to thank. So, we all have our great mentors and I appreciate them. So I had a great education at The Ohio State University. And then when I graduated, I wasn't thinking about internships. So I just went into general practice in small town Vermont, which I loved. And I learned a ton, but I realized when I was there that I still had a ton more to learn. Mm-hmm. So I thought it would be a good idea to do an internship. So I was fortunate. And then I applied to the West Los Angeles Veterinary Medical Group. And the reason I applied to West LA was because at Ohio State, when I was a student, there was a surgery resident there who had worked at West LA for 5 years before he came into the residency. So I applied for one internship, which, as we know today, is not a good idea applying to only one, but I applied to one, I got in, and then the internship changed my career. After the internship, I was a resident at Colorado State. After I finished that, I was an internist at Angel Memorial in Boston. I got to hone my gastroenterology skills and learn endoscopy because we had so many cases to manage. So 3 years at Angel, and then I answered a call to return to Los Angeles, which I did. So I returned to West LA in 1984, and in 1986-87, VCA started. So West LA was actually the first VCA hospital. My story there started with my internship at West LA.
Todd, I've known you for a number of years now, and I think this is the first time I've heard the Angel connection in there. What a tremendous training up and work opportunity that must have been.
It really was, Marie. When I was finishing my residency, I interviewed at 3 places and actually took the job that paid the least. But I thought it would be the best experience for me to grow and to see a lot of cases. And I think those years, as you know, after the residency, the first few years post-residency are really formative. So I learned a ton at Angel. They needed a gastroenterologist. They needed to buy an endoscope. And I knew a little bit about endoscopy, but not much. So I had to learn. And I did that. So I'd say the Angel experience was tremendously formative.
Yeah, it really speaks well, that and West LA and even our university programs, to the experience being in a teaching hospital. And you and I often talk about those early career experiences. And I think we're gonna circle back around to that in a little bit. But you found yourself at West LA, and then it became a VCA hospital. That was really a first in veterinary medicine, since at that time, all veterinary practices were privately owned. So walk me through a little bit about how that happened and what can you share about that time?
So it happened around early 1987. Mm-hmm. 3 of our business founders got together, and they had a background in operating human outpatient surgery centers. So they knew some things about medicine, human medicine, but they knew nothing about veterinary medicine. But they thought maybe we could use the same model that we have followed in human medicine in veterinary medicine. Mm-hmm. So they looked around and tried to find a hospital with owners that would be interested in selling. And they happened to come to West LA. So the concern was, as you mentioned, Marie, in veterinary medicine, this had not happened before, corporate ownership. And the concern was that it's going to be corporatized, and that's going to mean the business people are going to dictate the quality of the medicine. Mm-hmm. They're going to dictate how it's practiced. But that was never going to happen. It never happened in all the years of VCA. And I mean, the founders, Bob Antin, Art Antin, and Neil Tauber, didn't know anything about veterinary medicine. So they leaned on the doctors to shape the direction of the company. We started slowly, built up, but then, as you know, you built it up to become a company that owns 1,100 animal hospitals.
You were the first chief medical officer for VCA. Why was that position important to our founders? And what did you really want to accomplish with that role?
The most fortuitous thing for VCA is that the first hospital that they bought was a renowned hospital. It's the largest private hospital west of the Mississippi River, operating 24/7, 365.
Mm-hmm.
Had a general practice, specialty practice, ER, and had an internship program. So it was a great teaching hospital at the time. So that was hospital number one. And so when VCA started, there was recognition of the quality of medicine that was already being practiced. I said, listen, if we're going to do this, we have to make sure that we're always going to practice high quality medicine. That's the only way to go, because it was in our DNA at West LA already. And so that's how it got shaped. When VCA started, I was still the medical director, the executive director at West LA, doing CMO type work, but also still being a receiving clinician, still doing procedures. But from day one, quality medicine was the message. And over all the years in VCA, it became our North Star, quality medicine. And that's how the company became known.
When did you transition from being at West LA and having some clinical duties in addition to the leadership role? When did that transition to a full-time position as chief medical officer? And how had VCA changed during that time?
Well, the transition came in the 9th or the 10th year.
Okay.
So, the way we managed the medical side was, we didn't have that many hospitals in the early years, but we formed a medical advisory board, which I chaired. So there were 9 of us on the board, and that's how we started setting guidelines. We had 59 hospitals at the time, and we could manage that, But then we merged 2 companies that added another 100 hospitals. So we went from 59 to 160 hospitals. And that's when I had to make the decision and make the transition to the office, the administrative office. And it was difficult for me because I love clinics. But I thought, this is a great opportunity. It's time to do it. The first 3 months were difficult because I thought, what am I doing sitting at a desk all day long, writing programs and doing phone calls and all that? But it turned out to be a great move.
One of the things that led me to joining VCA in 2017 in a field position was really the focus on high quality patient care and world-class medicine. Your medical leadership was really instrumental in making that a part of our DNA. How did you build and grow that culture in your role that permeated throughout the company?
I think the keys in our medical journey were, number one, my personal passion to work as hard as I could to carry the quality medicine message forward. It was just in my DNA because of my background. And then the medical advisory board that we impaneled in 1994, that was important. We wanted to create a voice that was coming from a group and not just one person.
Right.
So we had some specialists, we had some generalists, and we came up with guidelines. And then in 1996, as we got to 160 hospitals, we realized we needed to really have medical oversight out in the regions. So that's when I developed the regional medical director position. Over the first 4 to 5 years, as was typical for VCA, this was not a full-time position. So this was individuals who were medical directors who we had selected from around the country. There was a group of 14 initially. And they worked maybe 25 to 30% RMD, and the rest was at their hospital. And I have to give a shout out to 2 of the original RMDs who are still RMDs today in 2025, Dr. Rocky McKelvey, who's based in Texas, and Dr. Susan Zobler, who's based in Florida. They were there from day one as RMDs, and they have been phenomenal and still are.
And still very, very active and contributing every day.
Yeah, so that was such an exciting time. So getting the RMD started and then going to full-time RMDs, you might think, well, why was the job not full-time initially? And it's just because we wanted to make sure it could work.
Right.
And VCA grew lean over the years. We always were multitasking. Everybody was. So it became a full-time position. We couldn't have done what we did with all the hospitals that we have and advancing quality medicine without the RMDs. They were the key, and they have been dedicated. They've been relentless, and just going door to door, hospital to hospital, having conversations and encouraging people and teaching, educating, and sharing the good word. So that was a huge part of our success.
I'm really happy that in 2020, we were able to add regional technician directors as a field role to that team to focus on a different area of our workforce, but tremendously important and working in partnership.
Another step up, right, Marie? Yeah, onward and upward, always improving and advancing. And it's great that we have those folks in their roles.
Todd, we both share a passion for early career development. We talked about that a little bit at the beginning of this podcast. And we both have completed rotating internship programs after being out in practice. So why are you so supportive of these programs, and how has VCA provided such great internships over time?
Well, it's great about the internships. The expansion of postgraduate education opportunities, I think, is one of the most exciting changes I haven't seen in veterinary medicine over the years. I mean, the internship numbers increased. There were more opportunities for new graduates to get training. And I've often said I wish every new graduate from veterinary school had the opportunity to do an internship, but we know that isn't the case. However, it would be really great if it could happen that way. It was my opportunity to do an internship myself, and the experiences I had, I just felt that changed my career tremendously. You talk to people years down the line and say, was it worth doing the internship? And did it make a difference for you? And honestly, I've rarely heard anyone say anything other than, I wouldn't trade it for anything. I learned so much. I'm excited about it because it's such a great opportunity for veterinarians to expand on their skills. It's all about becoming a better veterinarian as fast as we can help people do that.
Right.
And so in VCA, we started with one internship program at West LA, but then over the years, we were able to expand that as we acquired hospitals with internship programs, or as we started new programs, all the way to 41 programs and well over 200 interns being trained per year. So that's one of the things that, as I look back on all my years in VCA, one of the things I was most excited about is the opportunity to help young veterinarians on their career path, and whether they wanted to go out and become a generalist, an ER doctor, do a residency, go into marine mammal, zoo work, whatever they wanted to do, that we had a role in getting them started, giving them a great education. And of course, the onus is on us to make sure that we run the programs well and make sure that they're providing a great education to our interns. That's something that, we have to stay on top of, because if we're going to have interns come in and train with us, we better be delivering so that they can go out after that 1 year and really excel.
Well, it's the high level of education and also having programs that are sustainable. For many years, internships had the reputation that you were going to be working 100 hours a week and never get a day off. But things have changed, that it is entirely possible to provide a great learning experience and also to take care of our interns and make sure that they're able to have enough time to decompress between a shift and come back on, and not working 24 hours and all of the things that over time have happened in veterinary medicine. I'm actually very, very proud that VCA raised the salary standard for interns to make it possible for more great candidates to consider, because they're historically very low paying, and now we have a living wage in all of our programs, and it makes the choice of doing an internship for a student who has student debt and other obligations. They have an easier choice to get there, or somebody like you and I were, that we took a job in a practice to begin with, to be able to step out of that and back into an internship. We've been talking about this high quality of medicine through the entire existence of VCA, and we've had a long history leading veterinary medicine through medical standards and innovation. Tell me more about some of the early focuses of our support for initiatives before they became industry standard.
Yeah, it's been a great journey there, Marie. So it really started with our medical advisory board convening and setting standards. So we started in 1987. And we went 7 years or so just giving, soft guidelines and making recommendations. But in 1994, we decided, okay, it's time to get a little more directive and let's be consistent across the board. So the list of guidelines that we put together in 1994 included, number one, IV catheters for all anesthetized patients, because there were still a lot of animals undergoing anesthesia that had no catheter in.
Right. Most of them, as a matter of fact.
Yes. So we said, they're all going to have it. It's best for the patient. This is what we're going to do. And then routine use of pre-anesthesia lab work, more urinalyses with blood panels, making sure we were more thorough in our diagnostics. We brought in experts in anesthesiology and pain management. We put together teaching modules. We said, we're going to show you how. That was a big one and a very exciting one. Sending fecal samples out to the laboratory, out to Antech, rather than running them in-house was a huge one because the quality we just weren't getting good quality results. And so just getting them out to Antech was a big move. That was quite a project. And then one of the other requirements we came up with in 1994 was about CE requirements. And so that's when we set the requirement for 30 hours per year. And the goal was, I remember being in the meeting and we said, we want to have a higher requirement than any state out there. We're going to have the most. And so 30 hours was the requirement that we had for our doctors. And of course, some of our doctors would get 60, 80, 100 hours. Some were not getting very many, but we required 30 hours. And then the last one is we developed the quality care programs. So these are written documents that outline the why behind the medicine, why behind the IV catheters, the urinalyses, doing fecal tests, pre-anesthesia, lab testing, heartworm testing, and then a question and answer piece for the clients and client handouts. Now the technology has made things a lot easier, but we had all these written documents that we sent out. We did roadshow meetings, where we would go out to the various cities and bring in support staff, technicians and doctors all together and do a 4-hour program for them. And, I do as many as 8 of those, 8 4-hour programs in a 4-day period, just to try to get out and be with the people and answer questions and get them excited. So those were the programs that we started with back in the day, so to speak.
I recently have gotten to see all of those quality care recommendations. They're still really quite relevant today for great healthcare for veterinary patients and making sure that everybody was following good standards to be able to diagnose disease early at a time when we have a better chance of being able to cure or treat illness in pets.
Yeah, I'm glad you saw those, Marie. The other, when I wrote those, I had help I would tap into when needed. For example, the pain management piece, Bill Muir from Ohio State helped us with that. And so I could always say to our doctors, listen, this is being co-written by experts in universities. This isn't just VCA saying this. This is what the word right now is, what the experts are recommending. So I could always say, we're sharing information with you that's coming from a collaborative group of experts.
Another thing that I'm actually very proud of and proud to have seen you really work through this over a number of years was being able to ban elective feline declaws in our hospital. It wasn't easy to do that. Tell me about how that started and what the progression was when we finally were able to say, okay, we're going to stop this procedure.
Yeah, great question, Marie. So I remember back in the early 2000s when several cat lovers in the greater Los Angeles area were talking about, the negative aspects of declawing and that we should stop it. And initially, I have to admit, I was against their initiatives.
As many veterinarians were at the time.
Right. And so I was against it. But then over the years, as we learned more about the potential negative effects of declawing cats, the science was teaching us that this can really be a problem. I switched and I really got passionate about it because I thought this is just something that we really have to stop. It took about 4 years for us talking with our doctors and hospitals about, we really want to do this. And the RMDs, the regional medical directors, were absolutely key because you guys went out, you were part of it. You went out and you were talking to veterinarians one at a time about this initiative that we wanted to put in place. We didn't just come out with an edict right away. We came out with 3 or 4 years of discussion. And finally we said, okay, it's time. We need to take the step. I just felt that it was time to do this for our patients. And it is, as I look back on my career, I mean, this in June, I'll be celebrating my 48th year since graduating from veterinary school.
Congratulations.
Thank you. In all those years of all the things that I was able to do, one of the ones I'm most proud about is getting the declaw ban in place.
You've been involved in the development and growth of VCA both in Brazil and Japan with our hospitals there. So this gives you a really unique international lens. How is veterinary medicine the same around the globe, and what are some of the differences?
That was very exciting. So over the years, I had the honor of giving seminars in Japan and in Brazil. So I toured around, and of course, wherever I went, I always talked about VCA. You know, people in the audience wanted to know, well, where are you from? What do you do?
Mm-hmm.
And I talked about VCA. And so in both of those countries, veterinarians would sometimes ask, well, when can VCA come to Brazil? When can you guys come to Japan? We'd be interested. And, you know, no matter where you go in the world, if you walk into a waiting room at an animal hospital, it's always the same. You just look in the eyes of the pet owners who are there, look at the pets, look at the way they're interacting, and you appreciate the human-animal bond. It's always there. So this was an opportunity for us to take the model to other countries where the quality of medicine maybe was not quite at the level of the United States, but there are many veterinarians there that aspired to practice at a higher level.
Right.
And it just comes down to the education.
Mm-hmm.
They may or may not have that opportunity available, or they may or may not have opportunities to do internships or residencies. So the difference around the world is just the level of education.
Mm-hmm.
And I think that with Mars, now that we're global and in so many countries and with 3,000 animal hospitals and growing, getting into countries like India and others where we can really expand the knowledge base, help veterinarians grow, provide educational opportunities, it's just going to raise the bar of medical practice. So it was really exciting to help VCA Japan get started and also VCA Brazil, and they're growing and doing well. There's a lot of excitement. But as you know, one of the things they've been asking for all along is for educational opportunities,
right,
for help in getting the patient safety program started and, you know, not having to recreate the wheel. We've got all the programs built and we can share these with other countries. So I see that as a great point for the future where we're going to continue to raise the bar.
Yeah, that's very, very exciting. In 2017, VCA became a part of Mars. And in 2020, you joined Mars Veterinary Health. How has being a part of a larger organization really powered our growth and contributions to veterinary medicine?
Yeah, so that just helps us expand the reach that we have, the messaging about quality medicine. We've expanded that globally. And the improvement on the training programs and then the computer systems and getting everybody linked together and networking. So I think it's a great opportunity for networking, for sharing,
mm-hmm.
for dealing with common problems. And, you know, we can share what was successful in our history, what wasn't, and why it wasn't. And so I think it's really exciting. So it's a great time in veterinary medicine.
Mm-hmm.
What are the differences? You know, I think it's the level of education. What opportunities did veterinarians have when they were going through veterinary school? What can we do to expand that? You know, you see a lot of animals out on the street and, you know, maybe, you know, we can do more to help with spay-neuter programs,
mm-hmm.
better nutrition, whatever it is. But there's a lot of opportunity there. And again, it just comes back to, okay, what can we do to improve the quality of care and go back through all the basic programs that we've used over all the years now, all the way back to IV catheters, pre-anesthesia lab work, et cetera. And so I believe veterinarians all around the world are really excited about the educational opportunities. They want to learn more. They want to do better. And so our positioning with Mars gives us a fantastic opportunity to help along the way.
Todd, I want to congratulate you on your retirement from Mars Veterinary Health, although I know as you and I spoke recently, it's retiring from the position and not from veterinary medicine. So I know that you're staying really active. Share with me some of your ongoing ways that you're contributing to our profession and how you're going to stay active.
Yes, I love veterinary medicine, and so that's exactly right. I'm retiring from the day-to-day,
mm-hmm.
but still want to stay active. And so I'm going to continue doing continuing education programs, speaking at conferences, I love to teach the endoscopy wet labs that I teach at the Quendo Center 4 to 5 times a year, and just hands-on training and working on projects. So there will be some projects that come along. So I'm going to be open to helping along the way and hopefully staying engaged in some way with interns and residents. And there will be ways, but I definitely don't want to walk away entirely. That would be, to me, something I absolutely would not want to do. So I'm going to stay active in those ways.
We're nearing the end of our time together. And in closing, Todd, can you share a few things that excite you about the future of veterinary medicine and opportunities for growth for the profession?
Yeah, I see, as I look to the future, I see just the expansion of technologies. And for example, just AI to help with scribing and the electronic medical records, and being able to go into an exam room and have a conversation with a client, and having AI recording and a system that will actually take out the chit-chat that we do have in the exam rooms and just stick with the medical information.
Right.
So AI helping with the electronic medical records will be a big one. Expansion of AI in imaging and radiology and pathology, ClinPath, anatomic pathology. So I see AI as a big one right now. Educating veterinarians everywhere, and hopefully getting more veterinarians excited about really learning ultrasound or learning dentistry, advanced dentistry skills, or endoscopy or surgery, whatever it is. Mm-hmm. But having veterinarians expand their skills, and I think we need that in veterinary medicine, because the more we can do to introduce veterinarians to newer skills and newer ways of doing things, it would be a recharging type of a thing. But there's a lot of opportunity. We all love our pets, and to be able to help guardians of pets stay with their pets for longer is, to me, one of the best things we can do, and help them. So just onward and upward, better and better.
Well, Todd, I have greatly appreciated our time together. And also, I want to thank you so much for your guidance and mentorship that you've given me over years, and introducing me to VCA and getting me off on the right foot there. You are part of the reason that VCA is the tremendous organization that it is. So thank you so much. And thank you again for your time.
Thank you very much.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.